Department of Human Services briefing on the proposed 2024-2025 budget and priorities for the Department of Human Services. Thank you to all who registered and with the patience with the attending capacity on the morning webinar. We are quite popular this year, but thank you for your patience and for all the questions submitted. Given the volume of people who are on both calls and the number of questions received, we are not going to have time to take questions live, but we did get big number of questions submitted ahead of time. So thank you for those who did so. Following the calls next week, we will send out a document with those frequently asked questions and any questions that you have, you can follow up over the next couple weeks with your program offices. As a reminder, the governor's executive budget is online at budget.pa.gov. That has a lot of information about these initiatives and proposed investments. And DHS Blue Book will be published on the DHS website in the next 2 or 3 weeks. That has more information about what we're talking through today. Once again, the briefing will be posted on YouTube probably this afternoon or Monday for those who missed this, and we'll send that out to everyone who registered. And now I will turn it over to Secretary Arkush.
Thanks, Allie, and hello, everybody. We are really grateful that you've taken the opportunity to spend a few minutes with us this afternoon and get some more details about Pennsylvania Department of Human Services budget for the next fiscal year. On Tuesday, Governor Shapiro outlined a bold plan to build on the progress we've made during this past year by continuing to invest in Pennsylvania's economic vitality, support stronger schools at all levels of education, strengthen our communities, and promote opportunity for every Pennsylvanian. This budget sets out investments and solutions for challenges that face every county and every community across the Commonwealth, and will set a course to make Pennsylvania a competitive, attractive state to live, work, and thrive in. Governor Shapiro's 2024-2025 budget spans various themes and broad goals, including investing in children, students, and educators, charting a new blueprint for higher education, making Pennsylvania a leader in economic development, job creation, and innovation, ensuring Pennsylvanians have access to mental health resources, cutting everyday costs for Pennsylvanians, supporting and protecting vulnerable Pennsylvanians, combating gun violence, and ensuring access to effective emergency services, ensuring all Pennsylvanians have the freedom to chart their own course and the opportunity to succeed, and much more. These themes come down to a singular unifying mission: building a Commonwealth. Excuse me, sorry folks, there, just got kicked off my slide here for a second. These themes come down to a single unifying force, or a single unifying theme, which is ensuring that all Pennsylvanians have what they need to grow and thrive and be successful in our Commonwealth. So before we jump into the specifics of how this proposed budget supports DHS's work, I want to share a bit about the scope and complexity of our work. As you see, the Department of Human Services serves more than 3.5 million people directly through programs like Medicaid, SNAP, Child Care Works, and others we administer. This represents more than 27% of our Commonwealth's 13 million residents. And through other services, we touch the lives of millions more indirectly. It's hard to find someone who isn't touched in some way by our work. Be it through provider licensing, protective services, or coordination of care for children, adults, and seniors, there are countless opportunities for DHS's work to impact a person's life. Our work is a direct investment in quality of life and opportunity for all Pennsylvanians. Strong communities across Pennsylvania form the foundation of a resilient and economically thriving Commonwealth, and investments in DHS services and supports allow more people to have the opportunity to be part of that vibrant future. Think about the people that you serve or the community that you represent. They may face different barriers or need extra support to get ahead or pursue their goals, but they should not have to face those barriers alone. Today, we believe in this promise and opportunity for Pennsylvania and its people. Many communities, both rural and urban, have been stuck, effectively treading water or facing growing challenges to prosperity, in some cases for generations. The time has come to build bridges to success, to bolster, or in some cases build, foundational supports that have been weak or missing. While our work and involvement look different depending on individual programs and services, it is not enough to view our work as something that is here only to stabilize difficult circumstances. We must actively use our reach and service to help prevent and correct disparities, inequities, and structural barriers that place and keep people in poverty and poor health. The governor's budget initiatives and proposed investments outlined through this presentation support DHS's ability to meet current needs while also seeking to build bridges to future success for all people in our Commonwealth, no matter their present situation. These proposals span 5 themes that put Governor Shapiro's vision for opportunity and prosperity for all Pennsylvanians into action. These are foundations of health, stabilizing families, building opportunities for our future, tackling Commonwealth-wide challenges, and reinforcing the workforce infrastructure. So starting with foundations of health. Good health and well-being form the foundation of a person's ability to succeed in education and employment. The following proposals contribute to the essential health services that everyone needs to care for themselves and their family, and contribute to the stability and dignity that creates a foundation for future success. First, I'd like to share more details on important investments that Governor Shapiro touched on during his budget address on Tuesday. He shared the story of Cindy Jennings, who has struggled, like so many parents, to find consistent in-home support for her adult son, Matthew, who has disabilities and requires 24/7 support, leaving her and Matthew's grandmother to fill that crucial caretaker role. It's no secret that the economic and societal challenges of recent years have had serious adverse effects on access to services for people with intellectual disabilities and autism. People with intellectual disabilities and autism often have to wait to access these services because these services have never been funded to allow everyone with a need to access services when they are needed. There is a waiting list for home and community-based services. Adults with intellectual disabilities and autism should have access to the right services at the right time, but it's common for people to wait years to be enrolled in a home and community-based services waiver. This needs to end. We hold the values of everyday lives close in everything that we do. Pennsylvanians with IDA deserve the supports they need to live their lives with dignity and with the ability to achieve their goals. Our system of care and the dedicated professionals who serve Pennsylvanians with disabilities are and should be a bridge to successful everyday lives. Ensuring people receive the right services at the right time, not when capacity allows, is key to building this bridge and helping people live how they deserve. It's time to make a change. The governor's proposed budget is the start of a multi-year program growth strategy to expand access to home and community-based services and effectively end the emergency waiting list for adults. Intellectual disability and autism programs are the only Medicaid program with a waiting list. Currently, services are provided through waiver slots, allowing little flexibility to meet individual needs and limiting counties' abilities to be strategic to maximize the delivery of services with the funds they have. Program growth will be accomplished through both altering the management of waiver program capacity by directing ODP to work with our county partners to more efficiently manage waiver capacity by managing to a budget instead of to slots, and by adding waiver program capacity to the community living and consolidated waivers. Going forward, overall waiver capacity will be managed by the ODP Program Office and allocated to counties throughout the year based on need and performance to budget. To jumpstart this ODP multi-year program growth strategy, the governors directed ODP to immediately release more waiver capacity to counties. Program capacity to serve an additional 1,250 individuals in the community living waiver and 400 individuals in the consolidated waiver will be provided to counties in the current year. The proposed budget includes $36.1 million in state funds, which garners federal funds for a total of $78 million to serve an additional 1,250 individuals in the community living waiver and 250 individuals in the consolidated waiver in 2024-2025. Additionally, as many of you know, last September, Governor Shapiro directed ODP to begin an immediate evaluation and assessment of the rates paid to intellectual disability and autism programs that employ direct support professionals to inform the 24-25 budget. As a result of that process, the governor's proposed budget includes $217 million of state funds, which garners additional federal funds for a total of $483 million to support rate increases beginning July 1st, 2024. And as Governor Shapiro said in his budget address, we can't address the access to services issue without supporting the people who make this possible. DSPs are at the heart of this work and are essential to supporting Pennsylvanians with intellectual disabilities and autism. Their work allows countless families and caregivers to live and work with the peace of mind that their loved one is safe and has the care they deserve. To support these caregivers, the governors directed ODP to provide one-time supplemental payments to support workforce recruitment and retention this fiscal year. These payments will apply to providers and supports coordination organizations in the intellectual disability and autism adult waivers. ODP has begun the necessary application to the federal government to enable a one-time supplemental payment to providers equal to 6% of their ODP home and community-based services waiver revenue for July 1st, 2023 through December 31st, 2023. These supplemental payments are anticipated to be a $109 million investment, with $51 million coming from state funds for our workforce supporting people with intellectual disabilities and autism. Providers will receive information about their payment amount this spring. The supplemental payments made available to ODP providers can be used to cover recruitment, retention, any COVID-19 related staffing expenses for direct support professionals, frontline supervisors, or supports coordinators. This can include overtime, shift incentives, sign-on or retention bonuses, wages, and more. This funding will support providers unable to fill staff vacancies and providers unable to accept new participants into service due to staff vacancies. Based on the timeline for processing the amendment to the home and community-based waivers, we anticipate the payments will be made in May or June of this fiscal year. Also, to improve much-needed access to sign language interpretation for individuals in ODP programs, the governor's budget proposes to add sign language interpretation as a discrete waiver service. The budget includes $934,000, which with federal funds will become $2.1 million to include this service. Together, these proposals invest in and support parity and access to care and ensure this essential IDA workforce has the financial support to recruit and retain talented, dedicated, caring professionals. As this budget process moves forward, we need all of you to share your stories about why there is such a need for these critical investments. And we look forward to working with you to make this multi-year growth strategy a reality so we can end the adult emergency waiting list and build a bridge to success in everyday lives. 38 states currently have waiting lists for home and community-based services. If Pennsylvania begins to eliminate hours by growing our program, we will be a national leader in this space. Our community deserves this, and I look forward to working together to take this bold step forward. We all know that there are many lower income Pennsylvanians who are not eligible for Medicaid and may choose to go without insurance or limit use of that insurance due to deductibles and copays. To help people in these situations get essential preventive care, the Department of Human Services contracts with family planning providers around the Commonwealth that offer screenings for sexually transmitted infections, pregnancy counseling, cancer and other health screenings, and other supports for men and women. To support this work, we are investing a total of $4.4 million, including $1.4 million in state funds, to increase rates paid to these providers. As a physician, I can assure you that diet and health are closely linked. We now understand definitively that food is medicine. If people are going without meals or nutritious food is inaccessible due to cost or location, there is a direct adverse impact to a person's health. Seniors and people with disabilities are more likely to experience chronic health conditions such as diabetes and high blood pressure that are worsened by poor nutrition, leading to worse health outcomes and higher healthcare spending. A $17 million state investment provides over 106,000 elderly and disabled individuals with a $35 per month minimum food benefit, an investment in health and quality of life for some of our most vulnerable Pennsylvanians. And we also know that free or reduced priced meals during the school year provide critical nutrition to students and helps them learn. But during the summer months, many of these same students often experience food insecurity. The Federal Consolidated Appropriations Act of 2023 authorized the Summer Electronic Benefits Transfer, or SunBucks program, allowing states to offer a nutrition benefit that functions like SNAP during the summer months to families who receive free or reduced price meals during the school year. Pennsylvania has opted in to offer SunBucks later this year, and an estimated 600 to 900,000 children across our Commonwealth will qualify for this new program, which is paid for by federal funds. To assist with operational needs for the program, we are investing $3 million in state funds. Beyond shoring up the basic foundations of health for the Pennsylvanians we serve, individuals and families can at times need additional supports to create a stable home life, help them invest in their future, and contribute to a thriving Pennsylvania. Quality childcare and early education are essential to economic development and a thriving workforce. Parents cannot go to work and invest in their future and their family if they cannot afford or find childcare. And providers who step up and support lower income working families by participating in childcare works should be compensated in line with federally set best practices so they can continue to serve these families without jeopardizing operational sustainability. Investing in childcare works base reimbursement rates by increasing from the current rate, which is at the 60th percentile of private pay rates, to the 75th percentile of private pay rates, both meets the federal government's expectation for rates and will provide additional support to stabilize this essential industry. $62.5 million will be used to support this increase, which is primarily federal funded with $96,000 of state funding. This will be Pennsylvania's first time reaching this funding milestone. Quality childcare and early education providers make invaluable contributions to our economy and our children's future. Investing in this industry and the dedicated professionals who work in service caring for children pays dividends for all of us. Pennsylvania's minimum wage has not increased since 2009. And in case you're struggling to remember 2009, that's when Barack Obama was inaugurated president. The Steelers won their last Super Bowl. The Phillies were reigning World Series champions, and for all you Swifties out there, Taylor Swift won her first album of the year. In the time since, every neighboring state and most other states in the country have invested in their economies and their workforce. More than 775,000 people in Pennsylvania would directly benefit from a minimum wage increase to $15 an hour. Let me just say that one more time. 775,000 people across our Commonwealth are making less than $15 an hour. And nearly 85% of these workers are aged 20 to 65. 20 to 65. These are working adults who are bringing in less than $930 a month, or about $930 a month if they're making that $7.25 minimum wage. In today's world, you just cannot live on $930 a month. Research demonstrates that increasing the minimum wage will also have a greater benefit on women and workers of color who are more likely to work in lower income jobs that play such important roles in our economy and human services systems, especially in our caring infrastructure. People should not have to live in or near poverty because our minimum wage hasn't moved in 15 years. Our world has changed, and we cannot continue to leave Pennsylvanians behind. When we think about the future, one of the most important responsibilities that we have at DHS is the care of youth who are adjudicated delinquent and sent by a judge to one of our secure treatment facilities. The future of that youth depends upon receiving high quality, trauma-informed, safe, and person-centered treatment while under our care. We must never lose sight of the system's goal to help youth build a successful future. Pennsylvania is currently experiencing an acute need for more secure treatment placements due to reductions in private provider availability, paired with increasing commitments to the Department of Human Services secure treatment facilities. In recent years, we've seen a growing number of commitments specifically to our DHS secure facilities, overseen and operated by our Bureau of Juvenile Justice Services. An uptick of youth with designated time commitments and staffing challenges, not unlike what is seen by the private sector, have contributed to a waiting list for secure care. To combat this, DHS has established new state-run secure treatment units in northeastern and western Pennsylvania, and we have established more contracted partnerships with private providers to help meet local needs and get adjudicated youth into high-quality treatment as quickly as possible. We are now in the process of repurposing a vacant facility in Montgomery County to create the Southeast Youth Development Center, which is set to begin operations in the summer of 2024. We're also planning to increase capacity at Loysville Youth Development Center by the end of 2024. These efforts will allow us to connect youth with the treatment they need in a timely manner. An additional 170 staff positions are necessary to support these expansions. Investing $18.1 million will allow us to open 48 new beds at the Southeast Youth Development Center and expand capacity by 24 beds at Loysville. Through our efforts, we'll be increasing capacity in the Youth Development Center system, which could nearly eliminate the number of male youth on the wait list for secure treatment. A primary goal of treatment is to equip youth with social and emotional skills, as well as vocational training opportunities that prepare them to return home and set them up for a successful transition, which will limit the likelihood of future recidivism. This is a responsibility we take very seriously. Investing in the availability and quality of care is necessary to help empower our youth to forge a new path with greater opportunities and support for a successful, productive future when they return home. As I look across our Commonwealth, there are certain challenges that face people no matter where they live. And one of those is barriers to care for people in crisis and needing ongoing behavioral health care and social supports. And those that can't get them risk even greater challenges for their families and communities. Investments in systems of care ensure that our communities are equipped to meet urgent needs. As a physician, I cannot understate how critical our mental health is to physical health, quality of life, and our ability to go about our daily lives and move through the world. And as a former county commissioner, I saw the impact that mental health programs can have. But I also saw the challenges and limitations that our county partners must navigate every day because of years of continuous disinvestment in this system of care, one that is called on during critical, urgent situations that may sometimes be life or death. Last year, Governor Shapiro made the first investment in county mental health-based funding in nearly 20 years. This was a huge step forward after far too long, but it was just the first step. Now we must continue our commitment to our county partners, the work they do, and the people they help every single day. Governor Shapiro's 24-25 budget will continue this work by investing an additional $20 million in state funds, reaching an overall increase of $60 million per year by the 2025-26 budget in county-based funding. Crisis stabilization services are an essential component of a trauma-informed response to a behavioral health emergency, but they are not equally available around the Commonwealth. As the 988 crisis line has expanded access to crisis response, we must be sure that when someone calls, there will be someone to respond and somewhere to go. Emergency rooms or county prison systems are too often the only option for people, and this is not an appropriate place to treat a behavioral health crisis. Based on the trending rate of increased calls to 988 and the average number of callers whose crisis cannot be de-escalated over the phone, it is anticipated that the demand for in-person follow-up from a mobile crisis team and or treatment at a walk-in crisis center will more than triple over the next 5 years. An investment of $5 million will help establish crisis response systems in counties where they are currently unavailable and provide additional funding to the system throughout Pennsylvania to help cover crisis response when a person is uninsured or underinsured. We also need to be sure that a properly trained individual is there to answer that call to 988. Last year's budget invested $5 million to support staffing and operations at our 12 Commonwealth 988 call centers. The 2024-25 budget will continue our support to this lifeline and the people who talk with Pennsylvanians in crisis by investing an additional $10 million in state funding. These investments will support essential life-saving community supports and the call centers and staff who perform these heroic emergency response and crisis services for their communities. Our state hospitals and their dedicated, highly skilled staff work 24/7, caring for individuals with complex mental health challenges. In some cases, judges send justice-involved individuals who may not be ready or able to stand trial to our state hospitals for diagnosis and treatment. For a number of years, there has been a lack of community-based treatment options for justice-involved individuals who are placed in a state hospital because of involvement in the justice system. When it is determined that a person is able to begin treatment in a less restrictive setting or step down from state hospital treatment to a community-based placement, but has to remain in the hospital due to lack of community-based options, it creates a backlog for other forensic admissions. This creates delays across the system and can cause justice-involved people to remain incarcerated in county correctional facilities while they await care. Greater support is necessary to provide appropriate care for this highly vulnerable population and ease the burden on county prison systems. For 2024-25, the governor is proposing $5.75 million to support at least 5 county forensic initiatives that will expand options for long-term treatment and ease admission challenges in state hospital forensic units to further reduce the time to admission. And we are grateful for counties that are standing up to work in partnership on these efforts. The governor's budget also includes funding to move 20 non-forensic state hospital patients who could be treated in the community and move them to less restrictive placements, which would allow our state hospitals to serve patients with more acute needs. $1.6 million will support 20 more people being served in the community through the Community Hospital Integration Project programs. Recognizing that there can be challenges in finding appropriate placements for these individuals, this program will now be funded at $160,000 per person, an increase from the previous $125,000 commitment. Housing instability, homelessness, and a lack of affordable housing is another issue impacting communities across our Commonwealth and limits a community's ability to grow and thrive economically. Throughout the COVID-19 pandemic, the funding created by the Emergency Rental Assistance Program, known as ERAP, allowed counties to implement new strategies to stabilize people at risk of eviction and mitigate the potential short and long-term health and financial impacts eviction can have on a person or family. These programs were very successful, but that funding is ending. Building on the successes of the past few years, the governor is calling for a $10 million increase in the Homeless Assistance Program. This investment will support greater availability of eviction prevention, rental assistance, and other housing stability supports that we know work, that will keep people housed and ease risk to their individual health and ability to provide for their families. Additionally, we're investing $6.84 million to support legal aid services around the Commonwealth, with $5 million of those dollars dedicated to representation in potential eviction proceedings. As ERAP programs around the Commonwealth wind down, these investments are an opportunity to strengthen our homeless assistance program and support for people at risk of homelessness in a way that reflects lessons learned through ERAP and gives counties and communities more flexibility, resources, and tools to prevent evictions, stabilize emergencies, and meet local needs. Sadly, too many in our community do not feel safe at home. Domestic violence service providers around Pennsylvania are seeing an increase in need. Without adequate capacity, people may be turned away at risk to health and safety. In 2022, during one 24-hour period, providers experienced as many as 166 unmet victim requests. And during that same year, 11 programs were forced to reduce emergency shelter services. Unmet requests can result in adult and child victims of domestic violence becoming homeless or returning to unsafe situations. We are investing an additional $5 million beyond our current support to domestic violence service providers that will support both emergency response as well as medical and legal advocacy. And very importantly, some of this increased funding will go to prevention programming that seeks to reduce the prevalence of domestic violence, which we know is an intergenerational health risk. Now, in order for all of these proposals to be successful, we must ensure that the DHS workforce and our partners are adequately equipped to meet their responsibilities to Pennsylvanians. Earlier in this presentation, we outlined proposed investments in the direct support workforce contained in the 2024-25 budget. But our efforts to invest in the caring workforce does not end here. The 24-25 budget also directs the Office of Long-Term Living to undertake a study of rates paid to providers for personal assistance services. This analysis is just beginning, but it will give us a statewide assessment of this system of care to inform budgetary decisions moving forward for the direct care workforce. These dedicated individuals provide skilled care to older Pennsylvanians and people with physical disabilities that enable them to live safely and with greater independence and dignity in the home that they love. This care is critical to their quality of life. Pennsylvania is an aging state, and the need for this essential work is growing daily. This study will help us chart a path forward, and more information will be available to providers in the coming months. As the largest state agency in the Commonwealth, the Department of Human Services is committed to identifying and implementing opportunities to streamline and increase efficiencies wherever possible. Given our responsibility to provide services and monitor safety and quality that directly impacts health and safety for millions of Pennsylvanians, there are times where greater support will be needed to meet this responsibility. The Department of Human Services is investing $617,000 in state funding to add 10 positions to our agency complement. Each of these positions plays a role in supporting foundations of health, stabilizing families, building opportunity for our future, and tackling Commonwealth-wide challenges. Our workforce must be equipped to meet our responsibility to Pennsylvania and the people we serve. These targeted investments will ensure that we're working effectively and meeting the growing need that exists. I hope this presentation has given you a sense of the incredible opportunity presented in the governor's budget to build strong bridges to success for people and families across our Commonwealth. I just want to remind all of you that proposing a budget is just the first step. If there are initiatives in this budget that will help you or your community, opportunities that you're excited about, please let your state senator and state representative know. Tell a neighbor, write an opinion piece for your local paper. I just want to remind you that budgets don't pass themselves. We need broad-based support for these really bold initiatives that the governor has put forth. I personally just want to thank you again for joining us today. We're so grateful that you took this time, and I hope that this brief presentation has given you a little bit more insight into some of the specifics in our DHS budget. Many of you have submitted questions, and I'm going to answer a number of them in a moment. But as a reminder, the Blue Book will be published on the DHS website in the next 2 weeks, and more information about these initiatives and investments can also be found in the governor's executive budget. We'll now walk through a few of the questions that were sent in. You all sent in a ton of questions, and we tried to sort of group them thematically. And so we'll get through a few of them here as time allows. And if there's other questions that I don't touch on at all, we will do our best to respond, get you back responses. All right, so the first question is, does the 2024-25 state budget include a Medicaid rate increase for nursing home providers? The governor's proposed budget supports continuation of the rate increases that were just implemented on January 1st, 2024. Next is, we are interested in an update on the restoration of the adult dental benefit. So for those of you who may have not been following this issue closely, in 2011, Pennsylvania's Medicaid adult dental benefit was drastically reduced by the current governor at the time. And currently, that benefit excludes comprehensive access to crowns, endodontics, periodontics, and dentures. There is currently legislation that passed the House with bipartisan support to restore Pennsylvania's adult dental benefit in Medicaid. We are very supportive of this work and hope to see the bill's continued success in the state Senate so that it can become law. Poor dental health is detrimental to overall physical health and, as a result, increases healthcare spending for preventable conditions. Poor dentition also reduces the employability of the individual, particularly those who are seeking to get a public-facing job. The governor's budget does not include funds to restore adult benefits, but it does include $12 million for increased dental rates as directed under Act 34 of 2023, which will be effective January 1st, 2025. And obviously, should this dental benefit pass the Senate and become law, then funds would be appropriated to implement the benefit. All right, the next question is, can you talk specifically about how county mental health-based funding is impacted in this budget? So as I briefly touched on above, last year the governor made the first investment in county mental health funding since 2008, and that funding had also been cut by 10% in 2012. As part of that investment, the governor committed to increase county mental health-based funding to $60 million over subsequent budget cycles. This 24-25 proposed budget invests an additional $20 million, which will bring the total to $40 million. And we anticipate reaching that $60 million commitment in the 25-26 budget. The next question is, will there be any increase in funding for the recruitment and retention of child welfare caseworkers? Many counties across the state are facing critical shortages, putting children and families at risk. County children and youth agencies can request resources to meet their individual needs as part of the needs-based budget plan. There's a whole process to do this. As a former county commissioner, this is something that we took great advantage of. If a county's budget request to DHS include a cost for county staff recruitment and retention efforts, those requests were considered. So I want to just strongly encourage counties to work with their commissioners or their county executive to develop recruitment and retention strategies specific to their needs and request those resources through the needs-based process. I think you will find that you'll be very successful when you do that. Next question is, can you provide details on the proposed managed care organization assessment changes? DHS is proposing to increase the MCO assessment fee beginning January 1st, 2025. This will be the first increase since 2020. The final rate will be calculated and shared with the MCOs in April and published in the Pennsylvania Bulletin before the end of the calendar year. So many of you may have been following our work on the 1115 waiver proposal that we recently submitted to CMS. And this next question asks about whether or not we included any budget impacts resulting from this proposed waiver, specifically pieces that would be likely to begin within the fiscal year 24-25 budget, such as the proposed multi-year continuous coverage for children, and if not, how does DHS plan to incorporate it? The Bridges to Success Keystones of Health DHS 1115 waiver application was officially submitted to the Centers for Medicare and Medicaid Services at the end of January. And one component of this proposal is to establish a multi-year continuous coverage for Medicaid eligible children until they turn 6. So we are still very early in this application process, but if federal approval is received, and we would anticipate at the very earliest that we would not get that approval until sometime this fall, then we will work with the General Assembly to consider any budgetary impacts. Next question, why is the funding so flat for child welfare? When the Department of Human Services budget materials are made available, you'll see that the tentative needs-based allocations increased more than 5% over the 23-24 available funds. The need for additional state funds is limited to those replacing the loss for the enhanced FMAP made available under the public health emergency. Next, what are the effective dates of the new intellectual disability and autism service fees and the initiative to, quote, increase resources to providers of home and community-based services, end quote? All intellectual disability and autism waiver fee schedule rate increases, including adult autism, will be effective July 1st, 2024. Next question. What language is incorporated within the proposed funding increases to providers that ensures that the funding goes directly towards DSP salary increases? DHS does not set wages. We establish fee schedule rates that assume a set wage. Providers ultimately set this wage. But what I can tell you is that we can see from our wage surveys that when we increased rates in 2022, we did see an increase in direct support professional wages. So we would believe that we would see a similar pattern when the fees go up in the future. Is there a rate increase for direct care workers providing personal assistance services to people who receive home and community-based services through the Office of Long-Term Living? So the proposed budget continues to support the rate increase implemented in 2022 for personal assistance services. And as I mentioned earlier, we will also be undertaking an assessment of personal assistance services rates. Our direct care professionals help older Pennsylvanians and adults with disabilities every day and play a critical role in fostering more independence and keeping people safe. We will be working with providers with regards to data and survey collections. And next, are there any provisions to ensure mental health funding for schools does not duplicate and compete with county mental health programs? So we are actively working with the Department of Education to support school-based behavioral health services. And we are strongly encouraging school districts to partner with county mental health offices with the goal of working together to achieve your shared goals. To date, this funding has not been allocated with any requirements for collaboration between local entities. However, given that there is a workforce shortage in behavioral health and that school is not in session during the summer, it is in the best interest of our kids for the local schools to work collaboratively with their county leadership. We're also very fortunate that the governor has established through executive order the Behavioral Health Council. The Department of Human Services, the Pennsylvania Department of Education, and counties all have representatives on this council, which can serve as the place to share ideas and collaborate to build the much needed capacity in the school-based and county mental health systems. So that is it for questions. Again, I just want to thank you all so much for joining us today. There will be a recording of this presentation that will be posted shortly. And for those of you whose questions we didn't get to, we will do our best to get back to you fairly soon with answers to your questions. Thank you all so much. And that ends our presentation today.